Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and welcome to the Simply Health Podcast today, brought to you by ablehealth.us. And today we are going to talk about how we at Able Health, how we view medicine, and how we view it from a physiological approach versus a pathological approach. So it's a little bit of a mouthful, but we're really dealing with two systems of medicine, and there's brief parts where they overlap. There's different tools that they share, but the outlook is different. So a mainstream medicine would typically be more compared to a pathology approach. Pathology, when it's basically looking at it from a disease standpoint. Whereas Able Health works more of a naturopathic style approach, which would be a physiological approach, and it's more looking at imbalances in the physiology which are leading to these conditions, as opposed to just only looking at the condition itself. So if I want to try and break down the differences. So pathology looks at the symptoms, tries to group the symptoms together as a label of a disease name. And sometimes the disease names are often really just funny. It's just like a complicated Latin name of saying what the issue is. It's like someone comes in and like, oh, they have swelling, tenderness in the joints, therefore they have arthritis, which anytime they just slap the word itis on it just means inflammation, and the first word tells you what it is. So it's like, if you go to your doctor and like, oh, my joints are really inflamed, he's like, oh, well, it's diagnosed as arthritis. Like, oh, perfect, now at least I know what I have. All that arthritis means is that you have inflammation in the joints. It's the exact same thing you already went in for. And most of the cases where you get any type of itis, it's basically just saying the location and then adding itis to it. Whereas from a physiology standpoint, what they're doing is they're looking at those same symptoms, often even the same lab tests, and they're looking for an underlying imbalance in your physiology that is causing those symptoms, as opposed to just trying to label the symptoms and then give it a name that way. So it's looking at the underlying imbalance versus just locking it down to a disease picture. A pathology approach then generally takes that disease name that you're given, and then they're looking to match that with a medication typically. And even if you go to get to sit on a pathology class in med school, they basically will list the disease, and then the hands go up and like, this is the med. List the disease, hands go up, this is the medication. So everything is symptoms linked to disease name links to medication, which is probably not that surprising, because when you go to your doctor, it's usually 5 minutes, look at the lab test, and then here's your prescription. From a pathology standpoint, though, it's different. We're looking for those same imbalances. It's not uncommon, just in terms of communication, that they will use those names, because a lot of times people come in and they already know their condition. They know the condition name that's been labeled to them, and so we use that information. But then now we're looking for what's the underlying treatment that we need to correct this. So in this case, we're looking to see, is there something imbalanced with the body's response? Okay, 1 second here, sorry. Generally speaking, these treatments are a lifestyle change. So rather than looking for, okay, this condition, therefore this medication, it's more like these imbalances. Now we have to find out what is going on with your lifestyle that could be contributing to these imbalances, and then we have to correct those imbalances. Pathology generally assumes that the body's response is wrong and therefore needs to be blocked. So the treatment is different too. So not only are the medications and the style of treatment given, but the goal of the treatment is different. Generally, the goal for them is to block a response. If something's painful, you take a painkiller. If something's inflamed, you use anti-inflammatory. If the immune system's going off, you block the immune system so it can't work. Whereas from a physiology standpoint, it assumes that the body knows what it's doing, though sometimes misdirected because there's something else triggering it. So what we want to do is often support the body's response, or look for situations where we can determine what the triggers are that's causing the body to over-respond or inappropriately respond sometimes, and then remove those triggers so that the body can then start responding correctly again. So let me give some examples so it's just not just this theory. Think of an autoimmune condition. Okay, so autoimmune conditions, generally there's an inflammatory aspect, and then it gets to the stronger treatment. So generally speaking, you go in for the autoimmune condition, let's say rheumatoid arthritis, they look at it, it's like, oh, so it's rheumatoid, we know it's affecting your muscles and joints, so we'll give it the name rheumatoid arthritis. So the first thing we're going to do is block the itis. So they're going to start with things that block anti-inflammatories. And when that doesn't work, they're like, well, we know it's autoimmune, and the immune system's attacking itself, so now we need to block the immune system, so we'll use things like methotrexate or immunologics, which block your immune system. Yes, they can lead to cancer because it's blocking your immune system, but at least we've solved that label. Physiology approach. Inflammation of the joints. We already have it labeled as rheumatoid arthritis because usually by that time people have already come in with that label, and we can determine that with lab tests as well. This time, though, we're just thinking, okay, the body is creating this inflammatory response. What is it responding to? So often if the body is attacking itself, it's because it thinks it's doing the right thing, or there's something else mimicking the body. Number one, we look for food sensitivities. Adjust your diet and lifestyle, pull those out, help your body with detoxification. Sometimes there's some low-grade infections going on. We help your body deal with that. And then you see the immune response reduce on its own without having to block it. So you let the body heal itself without having to block that response, and then therefore you don't have the side effects associated with the treatments. So that is the difference, one example of how the difference would work. Okay. Generally speaking, as we kind of alluded to there before, pathology-style treatments have a lot more side effects because you are trying to block how the body works. Physiology treatments assume that the body can heal itself, and therefore, when you're working to support the body to heal itself, you don't see those side effects, because if you're doing anything that has a negative effect on the body and therefore blocking it, it can't heal itself. So that's why there's so many times that one or two treatments can treat so many different conditions, because the goal, there's common blockages to be removed. You remove those, and not only one condition improves, many conditions improve. So we're looking for those blockages so that everything can heal properly. Now, keep in mind, even though it seems like I'm completely knocking the pathology approach, both of these systems have a time and a place. The thing is that I find is that the pathology approach is trying to treat things that it's not necessarily that great at, like a lot of chronic health conditions. That is not the best place for it. The best place for a pathology approach is emergency medicine, or when things get to the point where it's been ignored so long that it is beyond the body's ability to heal itself. And a perfect example of this would be, say, someone, and this is where I think this style of medicine has its magic. Acute trauma, things have been broken beyond repair of the body. You have to get, and it's surgery. Surgeries are where they have come with surgery is remarkable. And I think the biggest thing that they've come with surgery is that it's just the least, if I could speak today, it would be great, eh? It's way less invasive. So they're able to do amazing surgeries with being much less invasive, so the body can heal itself faster after that. Imagine like a really bad car accident. Imagine a triple bypass surgery. These are things that have dramatic effects and huge benefits to the population. However, dealing with chronic conditions and the constant overprescription of medications has not been helpful. So that is where things should be going much more from a physiology approach. Now, you can't just label this naturopath and medical doctors. There's a lot of medical doctors in the United States who are taking more of a functional medicine approach, and this is growing. This is a rapidly growing field because they're basically starting to use these naturopathic principles in their own medicine. So it's not just MD versus ND or anything along those lines. It's about the practitioner, their training, and their mindset that they're using. So if it's a chronic, if it's something that's new, if it's starting with basically anything, if it's strained, physiology. If it's torn, if it's strained to the point that it's torn, pathology. If it's overworked or inflamed, physiology. If it's full out broken, pathology. This is why the pathology approach, like if you look back in the historical books of naturopathic, the historical books of medicine, what you'll see is that they've both been around for a long time, and the times where the pathology style treatments has taken off and trumped the physiology treatments, it's generally during times of war. And you'll see that. So it's like nobody during times of war care about, how's my digestion doing? Or I'm worrying with the skin. It's more like I've been shot, I need a surgery, I'm going to have my leg amputated. This is where the pathology style of medicine, from what I've seen in the historical literature, has just always blossomed and taken off because that's where it shines. In times where everyone's not dealing with these acute traumas and they're thinking about how can I just have, how can my life be better? How can I feel better? How can I have more energy? How can I correct these conditions without side effects and more medications? Physiology. So I hope that kind of explains. Now, Able Health works from a physiological standpoint. We don't need to diagnose. We need to just understand the underlying physiology that's leading to these issues. And then we can correct it with diet, with acupressure points, with herbal supplements, vitamins, teas, etc. So I hope this information was helpful and just kind of explaining how this works and how at Able Health we work so that we can improve your health and give you the best possible outcomes. This is Doc Yates signing off. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.